Hello, everyone, and welcome again to another episode of Success with Ces, where we help you make your dreams come true. Be sure to hit the subscribe button, the notification bell, and leave your comments and questions because I love to interact. Hello, everyone, and welcome again to another episode of Success with Ces. Today, I'm actually behind the camera, and in front of the camera, I have Dr. Fabia Younus of Greater Houston Dental Arts. Dr. Younus, welcome to the show. I'm happy to have you.
Thank you.
It's good to actually have you behind, in front of the camera, and as one of your patients. We've been talking about this interview for a long time, and it's good to finally have it here, taking place.
Yes. Not used to this, but yes.
Yeah, it's just a fun time, and for me to get to know you, and for the people out there in the various neighborhoods that we sponsor through Park Bench, to get to know you and to encourage them to consult with you if they have orthodontic needs or anything else in the way of dentistry. But welcome to the show, and tell the audience a little bit about yourself and where you're from and where you went to school and how you developed your interest in dentistry.
Okay. Ooh, that's a lot of questions together. So I was born in Pakistan, raised there partially. I moved to Canada when I was in high school. And then from there, my parents are both dentists. So that is where it sparked.
I see.
I never wanted to do dentistry. I was always, I loved numbers. I loved math and accounting. So I guess that helps me with running my office.
Yeah. Anybody that runs a business knows that it's very difficult. And aside from the product or service that you have, you've got to have a good track of your numbers and your metrics and
as
your
much
books.
as we like to do dentistry, which is definitely my passion, but I'm glad I do enjoy running the office. As an office owner, you're HR, you're accountant, you're bookkeeper, you're everything. So, and I enjoy it. So, So far it's good.
CEO and chief bottle washer.
Yes, that's exactly what I did before you walked in. I cleaned up the sterilization area. I just organized that.
Oh, okay. I did not know that.
Yes.
But that's good. So
you just do everything.
Exactly.
Yeah.
Small business owners and entrepreneurs, we all know that it takes a lot, and you are head of marketing and HR and everything. So it takes a lot, and your background and your interest in mathematics and accounting certainly does help that as well.
Yeah. So that's pretty much where dentistry came in. I did enjoy meeting people, so I love to socialize, and I felt like having a passion where I could meet people every single day, multiple people all day long, and getting to know their story, because I don't just practice dentistry. I'm involved in people's lives, and the moms that come in and bring their kids, and they're raising their kids, so I'm part of their life now.
Right.
So I just enjoy doing that. I just enjoy changing lives.
Do you know, as a patient, and I can say this, it was real nice because as a realtor, I have to set expectations for my clients, and as your patient, I came in here thinking Invisalign was going to be easy peasy, and it is to a degree. It is easy, but my expectation was that it was going to, maybe be 2 or 3 months, and then it's over with. But you coached me through it. You really, I don't want to say, read me the riot act or whatever when I was going off track, but you did a great job of explaining the process, and you coached me into doing all the right things.
Yes. Invisalign, the hardest part is compliance, unfortunately, and it's not. There's a lot of patients that go through that. There's kids, there's adults, we just have to work with the lifestyle, you know. Not everyone's gonna do exactly what you say. I mean, I'm a mom. My child's not gonna do what I say, so I can't expect my patients to do what I say. So, and this is not like, you know, this is not the end of everything if you're not wearing your aligners. So if your lifestyle doesn't allow for it, we just change things a little bit and make it work.
Yeah, we did. You know, I think we altered the course, adjusted the path throughout the course of the last year, but my results are great. I'm really happy with the way everything turned out. You know, I sensed, you know, when we first met, that my teeth were shifting because I'm 63 years old. I know that things move around, things shift and all, and instead of waiting until I was 65 or 70 or whatever, when it would have taken a lot longer, you know, we intervened and we went through we started with the Invisalign process right about a year ago.
Yes.
And so tell the audience, tell the folks out there in the neighborhoods, what other specialties you practice here, and what your clients can expect.
So I'm actually a dual specialist. Not very many of us out there at all. I don't think there's any. So there's no perio ortho in Houston. So I'm a periodontist and an orthodontist. The only other one I know is in Seattle. I think I just enjoyed being in school too long. But I think it gave me an edge. You know, I just understand, now I understand teeth, but I also understand the supporting structures of teeth and how I need to respect that while I'm straightening teeth also. So
exactly, and so for the layman out there, orthodontics is a little more well understood. It's braces and Invisalign and things like that, but periodontics is around the gums, the supporting structures for the teeth.
Exactly. That it involves basically, well, as a periodontist, I should be maintaining everything, making sure that you hang on to your teeth for as long as possible. And whatever I need to do for that, any kind of surgeries, grafting, bone, soft tissue grafting. But, you know, sometimes we lose teeth, and when we do that, then we do implants, and that's also something I do. So.
Okay, and so I think the average layman understands receding gum line. So what are the causes of a receding gum line?
There's a lot of causes. So there's environmental factors, then there is genetic factors as well. And genetic factors means, you know, some people just have very thin gums, just inherited, and they're more susceptible to recession. And when we see that, we guide them and make sure that they don't induce recession in their mouth. So things like excessive brushing or really hard brushing can cause it. There is also orthodontic treatment can cause recession too. So if we are not respecting the gums and the bone around your teeth, and we're pushing your teeth, you know, there's crooked teeth. There's only one way you can straighten them out, is push them out. If we push them out too far, that can cause recession in the future. So, you know, when we're treating kids with crowding, that's one big thing I'm talking to parents about, that, you know, because nobody wants to lose teeth. And, you know, there's parents that are resistant to removing teeth, but the earlier, I always say, the earlier you start, the better it is, because we can grow the bone, we can grow the jaws. The older you get, even in your teenage years, sometimes it's a little too late and we have to remove teeth. And that's because I want to respect the housing of the teeth and not cause problems for later on.
Right. I noticed through social media that you were giving a presentation recently. So first off, you have an Instagram account that you're very active, and it's very informative. What is that Instagram account?
Well, it's the handle is Dr Fabia Younus, my whole name, with a DR in front of it.
Okay.
Yeah, I mean, I'm not as active as I'd like to be. And that's for a reason, because I'm busier with other things, which is a good thing.
Yes, yes.
But, you know, outside of work, I am a mom, so I try to stay to that too. But yeah, last night was my last presentation. I presented for, so Invisalign wanted me to present for them because they've been watching my cases. Because for Invisalign, everything goes into the software, and the entire team at Invisalign helps me put together the plan, and I basically guide them on where I want teeth to be. So they've been watching things, and over the last 5 years that I've been practicing outside of residency, I didn't think there was things that I'm doing with Invisalign that I could achieve. And a lot of them are, you know, patients don't want to do anything but Invisalign. They don't want to do braces, and I'm like, well, we'll give it a shot. And a lot of those things we've been able to achieve, and because they saw all of that, they wanted me to come by and show the other orthodontists.
Interesting.
Because, you know, the perception is Invisalign can't be used for everything. And it's true to a degree. But I feel like I can really, you know, again, as a periodontist, I can really control the 3-dimensional position of teeth with Invisalign. So there are times where I tell patients I want to do this with aligners. I won't be able to achieve this with braces. And there's times where I say, I don't think I can do this with aligners. We need to. And there's times where, you know, we make it work and we do a hybrid. You know, we put braces on one arch, start with Invisalign on the other, then get to, I'm sorry.
That's okay. Yes. We're here before hours, folks. We're here before hours, and Dr. Younus is about to get really busy here in a second. So we appreciate your time, and again, tell the folks how to reach your office.
How to reach my office? Well, so our website is greaterhoustondentist.com. There is a form you can fill out where you can try to book an appointment.
Okay.
That's as someone who's always on the go, that's the easiest thing for me. That's why I wanted that on my website. We just get a note here at the front desk, so whenever, even if you like in the middle of the night you want to get in touch with us, you can do that, and the next morning we'll give you a call. Our phone number is 713-417-3327. And any one of us will answer the phone.
Excellent. I know it's very surprising. I'll call the office to change an appointment, and Dr. Younus answers the phone. It's fantastic.
Yes. We just want to, you know, whenever we get a phone call, we want to make sure that we're not going unanswered, because it's, you know, patients are taking the time out to call us, and we want to be able to answer them. So if I'm close to the front and somebody's busy, I'll go and answer the phone.
For sure.
And that's part of being a team.
Yeah, exactly. Yes. Well, thank you so much for being on the show today. Really appreciate your time. And for those of you out there, be sure to subscribe, leave your comments and requests. We love to interact here. And if you do have any questions about Invisalign or regular orthodontics, leave your comments and questions. One last note, Dr. Younus, you have a promotional event, a promotional offer for the folks.
Yes, for the summer we are, I think we do it every summer actually now. We're doing a $500 off Invisalign or braces for any patients that don't currently have braces or Invisalign in their mouth with us.
That's a great offer. That's a great offer. $500, folks. Look on the Park Bench site. We'll be sure to put that on there as well. And you guys have a great week, and keep an eye out for the next episode of Success with Ces. We'll talk to you soon.
All right. Thank you.
Bye-bye.